Hello dear listeners, and welcome back to Elderly Reminiscences, where we explore valuable life lessons, share essential health tips, and discover ways to maintain a happy and fulfilling life as we age. Today's topic is one that's incredibly important for all of us, especially as we grow older. 6 silent signs your heart might be failing. What seniors need to know. Heart health is something that affects every part of our well-being. A strong and healthy heart keeps us active, energetic, and able to enjoy the things we love. But as we age, our hearts become more vulnerable to certain conditions, and sometimes, the warning signs are not as obvious as we might expect. Many people associate heart problems with classic symptoms like chest pain or discomfort. But in reality, heart failure often presents with more subtle, silent signs that are easy to overlook. Ignoring these early warning signs can lead to serious complications, which is why recognizing them is so crucial. In today's video, we'll explore 6 silent signs that your heart might be in trouble. By knowing what to watch for, you can take action early, seek medical attention, and protect your heart for years to come. So let's dive in and uncover these hidden warning signs. Unexplained fatigue is one of the earliest and most overlooked signs of heart trouble. It's normal to feel tired after a long day or after physical activity, but when you find yourself feeling constantly exhausted for no apparent reason, it may be a sign that your heart isn't pumping blood efficiently. When the heart struggles to pump enough oxygen-rich blood to the rest of the body, it forces your body to work harder, leaving you feeling drained and weak. You might notice that simple tasks like walking up the stairs or doing household chores leave you feeling unusually tired. If you're experiencing persistent fatigue that doesn't improve with rest, it's worth discussing this with your healthcare provider. Shortness of breath, especially during physical activity or when lying down, can also be a subtle indicator of heart problems. When your heart isn't pumping blood effectively, fluid can accumulate in your lungs, making it harder to breathe. You might find yourself feeling out of breath after light activity, like walking a short distance or even just standing up. Some people also experience difficulty breathing when lying down, which may lead to frequent waking at night, gasping for air, or needing to sleep with extra pillows to stay upright. If you notice these changes in your breathing, don't ignore them. It's a sign that your heart may be struggling to keep up with your body's demands. Swelling in the feet, ankles, and legs is another common yet often ignored sign of heart failure. When the heart can't pump blood effectively, fluid builds up in the tissues, leading to swelling, also known as edema. This swelling is usually more noticeable in the lower extremities, where gravity causes the fluid to accumulate. You may notice that your shoes feel tighter, or that your ankles look puffier than usual by the end of the day. If you press gently on the swollen area and it leaves a dent that takes time to bounce back, it's a sign that fluid retention may be occurring. Persistent swelling should never be ignored, as it may indicate that your heart is under strain. A persistent cough or wheezing that doesn't seem to go away can also be a silent sign of heart trouble. This happens when fluid builds up in the lungs, causing irritation and resulting in a chronic cough. You might notice that your cough is worse at night, or when lying down. In some cases, people with heart failure may even produce a pink, frothy mucus, which indicates the presence of fluid in the lungs. While coughing can be caused by many different conditions, if it's persistent and accompanied by other symptoms like shortness of breath or swelling, it's worth getting checked out by a doctor. Sudden and unexplained weight gain over a short period of time can also be a warning sign that your heart is struggling. This type of weight gain is often due to fluid retention caused by a failing heart. If you notice that you've gained more than 2 or 3 pounds in a day or 5 pounds in a week, it could be an indication that your body is holding on to excess fluid because your heart isn't pumping effectively. Monitoring your weight regularly can help you identify sudden changes that may signal an underlying heart problem. If you notice rapid weight gain that can't be explained by changes in diet or activity, contact your doctor. Dizziness or fainting can occur when the heart isn't able to pump enough blood to the brain. This can lead to a drop in blood pressure, causing lightheadedness, dizziness, or even fainting. You might feel dizzy when you stand up quickly or when you've been standing for a prolonged period. If these episodes happen frequently, they may indicate that your heart is struggling to maintain adequate blood flow. Fainting, in particular, should never be ignored, as it may be a sign of a more serious heart condition that requires immediate medical attention. Recognizing these silent signs of heart failure is the first step toward protecting your health. While these symptoms may seem mild or unrelated at first, they can signal that something is wrong beneath the surface. Heart failure is a progressive condition, meaning that it tends to get worse over time if left untreated. But with early detection and appropriate treatment, it's possible to manage the condition and maintain a good quality of life. If you notice any of these signs, persistent fatigue, shortness of breath, swelling, chronic cough, sudden weight gain, or dizziness, it's important to talk to your doctor. Early intervention can prevent serious complications and improve outcomes, giving you a better chance of living a longer, healthier life. Now that we've explored these silent signs, I'd like to leave you with a gentle reminder. Listen to your body. Your body often gives you subtle clues when something isn't quite right. Paying attention to these signals and seeking medical advice when necessary can make all the difference. As we close today's discussion, I'd love to hear from you. Have you or someone you know experienced any of these silent signs of heart trouble? What steps have you taken to protect your heart health? Please share your thoughts and experiences in the comments below. We'd love to hear from you. Thank you for joining us today on Elderly Reminiscences. If this message resonated with you, please consider liking, commenting, and subscribing to stay connected with us. Until next time, take care of yourselves, listen to your body, and continue embracing the beauty of life's journey.